Thank you.
Thanks, guys. See you.
Thanks for the time, John. Appreciate it. Okay. Now for the boring part of the news. Okay, so today HHS released a new report showing that the lowest number of Americans in history are uninsured. Today, just 8%. This progress did not happen by accident. More than 35 million Americans are enrolled in Affordable Care Act related coverage. The highest total on record. That includes 21 million people who are enrolled in ACA's expansion of Medicaid, and 5 million more people have gained health insurance coverage since the beginning of the Biden-Harris administration, in large part because of the improvements to the ACA in the American Rescue Plan. In order to keep this progress moving forward, Congress should pass the Inflation Reduction Act, which will lock in an average of $800 per year savings in health insurance premiums for 13 million Americans and prevent 3 million Americans from becoming uninsured. Today, President Biden, as you all saw for yourselves earlier, joined Governor Gretchen Whitmer, members of the Michigan congressional delegation, and business and labor leaders to mark the signing of the governor's executive direction to implement the CHIPS and Science Act of 2022. This is just the first example of the federal-state partnership that will launch across the country as states leverage its once-in-a-century investment in their own states to bring in new projects and to create the project jobs. We will have, I know folks are wondering and asking, but we will have an announcement on the official signing of CHIPS and Science Act soon, which will lower the cost, as you all know, you've all heard us say, everyday goods, creating high-paying manufacturing jobs across the country, and strengthen our national security and U.S. leadership in the industries of the future. Lastly, a growing body, I'm sure you all saw, of economic experts have analyzed the Inflation Reduction Act and agree that it will lower cost, reduce inflation, and address a range of important and long-standing economic challenges. 126 leading economists, including 7 Nobel Prize winners, former Treasury secretaries, and a CBO director, and former CEA chairs wrote to Congress this morning endorsing the Inflation Reduction Act and calling for its passage. They wrote that these investments, and I quote, will fight inflation and lower costs for American families while setting the stage for strong and stable and broadly shared long-term economic growth, end quote. They note this package will, again, I quote, quickly and noticeably bring down healthcare costs for families and would be more than fully paid for, end quote. They also underline that the revenue raised to finance these investments would come exclusively from wealthy individuals and corporations. These are major priorities for the American people, including tax fairness, closing the tax loophole, as you heard us say, and where the president and congressional Democrats have a verified plan to fight inflation, congressional Republicans, on the other hand, are standing against these investments because they are more about protecting tax welfare for those who game the system than they do about curbing inflation. They are screaming bloody murder because this bill repeals sweetheart deals that let hedge fund managers pay for less income tax than the average American, or stop multi-billion-dollar corporations from exploiting loopholes to pay literally nothing, or stops shielding wealthy tax cheats taking advantage of everyone in this room. As you all know, this year, congressional Republican like Rick Scott proposing raising taxes on about 100 million middle-class Americans. 100 million middle-class Americans. Americans have a clear choice between these agendas and the values behind them. Do we attack inflation with the Inflation Reduction Act, which we know works or will work? Or do we extend the pain of inflation like congressional Republicans are arguing for because they think it's more important to let the wealthiest Americans and big corporations take advantage than all of us, and then to cut costs for the middle class? That's what we're left here. Those are the choices that we have to make. Okay, with that, Zeke?
Thanks, Karine. I'm getting word from some of your staff. You might have a bit of a hard out in 15, 20 minutes or so.
Yep.
But there's 2 questions on the drone strike in Afghanistan, following up on some of John's answers earlier. Does the president believe that the strike against al-Zawahiri disrupted an active plot against the United States? And also, has he been briefed on any threats to U.S. interests at home or abroad, in potential retaliation for taking out al-Qaeda's top leader?
Look, the way I would just reiterate what John Kirby said up here. The president has consistently said that he will now allow Afghanistan to become a safe haven for terrorists. He has said that a year ago, and he continues, and we met that commitment. And what I will say is that we showed that without American forces on the ground in Afghanistan and in harm's way, we remain able to identify and locate even the world's most wanted terrorist and then take action to remove him from the battlefield. And that's what we did. That's what the president talked about yesterday, and that's the action that we took on Saturday. I'm not going to go into any intelligence previewing or hypotheticals or anything like that. All I can say is we took action. This is an operation, a counter-terrorism operation, a precise counter-terrorism operation that we took in Kabul, Afghanistan, as you know, on Saturday. And this is something that the president has said we would be able to have the capabilities of doing that over horizon approach, and that's what the president was able to do. We have to remember who he was. He was a Amir to the Al-Qaeda. He was someone that we were not able to get those 10 years that we did have troops on the ground. And when the president made that decision to stop this, to end a 20-year war that cost $2 trillion, that put American women and men in our military at risk, when he decided to do that, less than a year, we were able to get him. And so that's what matters. I can't get into any specific intelligence from here.
And then the president obviously is still isolating with COVID in the residence. He was while this strike took place, and also when he authorized the strike last week. Can you provide a little bit of color in terms of how he was briefed on it? How the strike authorization was given? Was this all taking place over Zoom or secure video conference? Could he be in the situation room?
So as you know, the president could be president anywhere, and as you know, also, as you just mentioned, he's isolating in the White House residence, as he has been since he tested most recently from a rebound positive on Saturday, and so he's able to do these types of conversation with his national security team, clearly through secured lines, and that's what he was able to do. We have laid out the best that we can, right, to share with all of you the steps that were taken to make this decision. I believe it was July 25th where he actually gave the authorization to move forward. This has been weeks and months in discussion with his national security team, leaders from his national security team, to have this conversation. And as we all know, on July 20th, 10 minutes or so before the 10 p.m. hour, the action was taken that the directive that the president gave. Again, the president can work from anywhere, including the White House residence. That is always the case, and he has been doing the job for the American people 8 plus 10 hours a day, as he has said to me many times during his isolation.
Just quickly, Karine, the DOJ filed a lawsuit against Idaho for its near total abortion ban, saying that it violates federal law. I mean, does the White House have a comment on that? And is the president aware? Does he have any thoughts on this lawsuit?
So just a couple of things that I do want to say on that, because I know that this just happened. So the administration, President Biden, remains committed to defending reproductive rights. The Department of Justice, as you just stated today, sued the state of Idaho, whose abortion ban, set to go into effect later this month, imposes a near total ban on abortion and criminalizes doctors who provide abortions. Idaho's law and its treatment of women is devastating, it's extreme, and threatens lives, period. Federal law makes clear doctors must provide women emergency medical care, including abortion services, to stabilize women facing health and life-threatening conditions. But under Idaho's near-total ban on abortion, women seeking emergency care for medical conditions like ectopic pregnancies or hemorrhages can be denied medically necessary health care by doctors. To put a finer point on it, pregnant women whose health and lives are in serious jeopardy may not receive the care they need under Idaho's abortion plan. President Biden has said many times that the only way to fully secure a woman's right to choose is for Congress to take action to restore protections that Roe had given women for almost 50 years before the extreme decision was made at the Supreme Court over a month ago. Until then, the president is doing everything in his power to defend reproductive rights and protect the access to safe and legal abortion, and then we're going to continue to do that.
Do you have any thoughts on specifically the lawsuit today?
I have not spoken to him about this lawsuit today specifically. This is the first that you're hearing from us on this today.
Just a question, following up on Zeke's. This has been one of the most successful weeks of the president's tenure in the White House so far. I'm wondering if it's just a coincidence that it's happened while he has largely been isolating in the White House. The CHIPS bill has passed, a historic agreement with Mr. Schumer.
What are you trying to say here?
I'm just wondering if the White House finds it coincidence. The president had a successful 2020 campaign where he was mostly working from his home. Work from home has seemed to be successful for the president.
Tyler, my goodness, jeez. Oh my gosh, the cynicism. Look, the president is going to continue to work for the American people regardless. It doesn't matter where he is. I hear what you're saying, but we've had successes over the last 18 months. It's not just been this week, right?
This spurt has been a quite successful week for the president by all accounts.
Yeah, but it's not the first time. We had the American Rescue Plan. We had the bipartisan infrastructure deal. We've had other successes in this White House. And so, what we have seen the past couple of days is the president grateful, absolutely, for what we're seeing from Congress, the work that we have continued to do with them, the partnership that we have had with them for the past 18 months. When you look at the Inflation Reduction Act, that's something that we have been working so hard for, that talking about during the campaign, that is like a down payment from what he was talking about from 2019 that we're now seeing moving forward, and we are grateful for that, and so we're going to the CHIPS Act, as you just mentioned. He did an event with the governor of Michigan, and that's going to be something that we'll see more on, those type of events with state local officials. But look, I will say this is all what we're seeing right now is because of the hard work of this administration, is because work that we have been doing for some time now. It just happens to be coming down at this time. But I wouldn't put it all together in one week or two. I'm just saying this is the work that we have been working towards. This is the hard work of this president. This is the hard work of this administration to continue to do the business of the American people. And he's still been working. He's still been working.
It's just at a time when, for the first time, when he has been forced by his medical diagnosis to stay in the residence, there's been a string of successes. I'm getting the sense that you're saying it's just a coincidence that the timing is aligned, but I don't want to put words in your mouth.
Tyler, my goodness.
I just think it's an interesting phenomenon that we've seen across a range of his priorities. They've all kind of come together.
I think we should just be really thrilled and really excited that we're getting work done for the American people, and I think that's what matters at the end of the day. Go ahead, Tam.
Just a couple of quick infectious disease questions. First about, monkeypox and the president's COVID. First on the president's COVID, I think you may have answered this before, but I'm a little confused about when he would come out of isolation. Is it 5 days? Does he need to test negative twice?
So
Could he be stuck there
I
forever?
believe we answered this when we sent out a pool note on Saturday. I hope no one wants that to be stuck forever. Some of us here have had COVID. You want to get out and you're ready. When you're ready to go, you're ready to go. We sent a pull note out. We're going to follow CDC guidance on that. I believe it's 5 days of isolation, and then clearly with the test, a negative test. We're going to continue to share with all of you what his personal physician is sharing with us on his condition. You guys got an update on he's doing fine, he's doing well, and he's ready to just continue to work, but work in person and not from the White House residence. So that's going to continue.
And then the other question is about monkeypox. The access to vaccines and treatments has been pretty uneven at this point, with patients and their doctors kind of muddling through and trying to figure it out. And we're wondering what the new monkeypox response coordinators will be able to do to improve this situation, or what they're being tasked with.
So they were both lead, Mr. Fenton and Dr. Dasakalakis will lead the federal response to the monkeypox virus, as you just mentioned. They're going to be coordinating efforts with HHS, DHS, and other federal agency and teams. This is not the first time, clearly, that we have done this. We have, you guys got to know Dr. Jha for a couple of days with me up here at the podium during the president's first bout with COVID. And so we've done this before, and so this is not new. Each federal agency will continue to play an important role in the response. The monkeypox response effort will be the best able to coordinate across the federal entities, listen to the needs of communities, and ensure timely follow-up. Secretary Becerra, Dr. Walensky are playing their critical roles in the monkeypox response to date, ensuring that federal government can be responsive to testing, treatment, and vaccine needs of communities and nationwide. One of the things that I did want to lay out about their specific expertise, operational expertise, that's really important as we think about the coordinator and the deputy coordinator, is that they have over 4 decades of experience in emergency response and manageable national and global public health issues such as COVID-19 emergency response, HIV prevention, and other disease control and urgent national crises. And as we talk about equity and being and expanding equitability, this is something that they have experience in, and they will be working through as well. And look, you know, we have about 1.1 million vaccines that are available across the country. We are procuring another 5.5 million doses. And so this is what we're ramping up, working on, having a comprehensive response to monkeypox. Another thing that we need to do and that we're doing is making sure that we have the testing out there. I talked about yesterday how we have the capacity of we've met the testing capacity of 80,000 tests around across the country, and outreach. So those are the things that we will continue to do. We always know there's more work to be done. And so one of the reasons that we had made sure that we announced the coordinator for monkeypox. Yeah.
Thanks, Karine. On the Inflation Reduction Act, is the primary aim of this legislation to reduce inflation or to fight climate change and reform the prescription drug pricing system?
I think all of it. I don't think it's, I think we, you know, one of the things that the president has talked about, you've heard us talk about, is one of his economic priority is to lower costs, which is fight inflation. We see it in the name, Inflation Reduction Act, and we have heard, I just listed out 126 economists who agree with us that is going to lower inflation, and which is incredibly important. But we can't forget the historic investment to climate change, right? To fight the climate crisis, which is something that the president has been doing from day one. He's taken bold actions. He wants to make sure that we lower those energy costs for families, all connected. I think they're all connected. You think about the pharmaceutical drugs. This is also historic, as many you know, Democrats, including this president, has been fighting for a very long time to make sure that Medicare can indeed be able to negotiate and lower costs for our seniors. So I wouldn't pull anything out. I think this is together is going to lower cost for families. And if you think about the deficit, bringing down the deficit, adding another $300 billion to the $1.67 trillion that we saw last year, that's going to help as well fight inflation and lower costs.
It is called the Inflation Reduction Act, and it seems that the most favorable interpretation from economists, including those that the White House has cited, is that this legislation will help bring down inflation in the long term, perhaps later this decade. But there's near universal agreement that this is going to do very little to actually bring down inflation in the near term, which seems to be when Americans would be looking for an Inflation Reduction Act to actually address inflation.
Look, that is something that we disagree with, right? We think that this is going to have some effect for American families when you think about negotiating with Medicare, and so that it could lower cost for your grandparents, for people who are senior in your household that you're trying to help, and make sure that they're able to get that funding or those funds or pay for those chronic medicine. That matters. And so that is really important as well. There's going to be rebates for families so that they're able, as it relates to energy costs, it's going to matter as well. Those are huge. Those are incredibly big for families just across the board, especially in the middle class. And you think about congressional Republicans and their plan, it's the complete opposite. They are not interested in lowering costs. If they were, this is it. This is the bill that exists in the House right now, in Congress, I should say, in the Senate at the moment, that could do that. And they don't want to jump on board to help us lower costs for families.
But do you have any evidence that this is going to lower inflation in the short term?
Look, I just listed out 126 top economists who said that it's going to do that. I have
They didn't say in the
quote.
short term, they just said general.
Well, I'm just saying that it is a step forward. We do believe that if you lower cost for Americans, that matters. That is incredibly important, because when you think about inflation, right, you think about how it's increasing prices. Right? People are paying more for gas prices, and we saw the work that we have done in this administration for the past almost 7 weeks. Right? We have seen gas prices go down, saving families like $80 a month if you have a two-car household. That matters. If you think about prescription drugs going down, bringing down the cost, that matters. That is connected to what the pain, the inflation that of American families are talking about. And when you talk about lowering the deficit, this is what this will do. That matters as well. And so, we believe it is, if you look at the name of the legislation, Inflation Reduction Act, it's going to do that. We have support of economists who say it's going to do that as well. And so we are grateful for this piece of legislation, and we hope it gets to the president's desk as soon as possible.
Very quickly on Saudi Arabia, the State Department today approved the sale of these 300 Patriot missiles. It was announced the same day as the extension of this truce in Yemen. Were those two things connected?
I don't have anything to share on that. I'm going to move on, though. Go ahead.
We heard John Kirby say today that the threat from al-Qaeda is not over, but can you talk about how big of an operational impact on al-Qaeda this strike on the Zawahiri will have?
I'm not going to go beyond to what John Kirby said today.
Hey, Karine. Yeah, so on the Inflation Reduction Act, so there's a corporate tax increase to a minimum of 15%. How confident is the president that the companies will not pass that cost on to people in the form of higher prices?
Look, the reason why we talk about we think the global minimum tax of 15 is, or the corporate minimum tax of 15 is so important, is because you have 55 companies, corporate companies right now, who pay absolutely nothing, who pay $0, and by doing this, we are fixing the tax loophole. It is important to do that. It is important to have a fairer tax system, and it is important to just for people to pay their fair share. We're talking about tens of billions of dollars of profit that we are seeing these companies bring in, and not paying a cent, not paying anything for it. I cannot speak to your question that you're asking me. I cannot speak to that. What I can speak is to this legislation and why it's so important, and why we need to get it done. And there should be bipartisan support for this legislation. There should be. When you think about Medicare, when you think about energy costs, when you think about the deficit, lowering that deficit, continuing to do that, and just making sure the tax code is fair. It's like people are paying their taxes. There's nothing here that we should be against. We should be supporting this legislation and delivering for middle-class families. Go ahead.
Thank you. Later this month, India will be celebrating 75th Independence Day. It's the world's largest democracy. It has done a lot in the last 75 years. As the president of the world's oldest democracy, does the president have a message to the people of India or the Indian Americans as well?
So we congratulate the people of India on 75 years of independence. India's nonviolent freedom struggle was an inspiration to the world, and we hope that the next 75 years see India continue to prosper. This year, the United States and India also celebrate 75 years of diplomatic relations. As the world's oldest democracy and the world's largest democracy, respectively, we will continue to work together every day to deliver opportunity, security, freedom, and dignity to our peoples. We are partners in many important areas, including defense, vaccines, climate, tech, and our ever-growing people-to-people connections. The United States will continue to work with India to advance a free and open Indo-Pacific and address the challenges both our countries face around the world. All right. Okay. Anything? All right. Thank you, guys.
Thank you.